The Medicaid provisions in the reform law really give, finally, the ability to provide health insurance coverage based on income instead of personal characteristics. For years, the Medicaid program has covered low-income children, some of their parents, people who are aged, blind, and disabled. But if you're a childless adult without dependent children and without a disability, even if you're extremely poor, you've been ineligible for the programs. It's estimated that around 16 million low-income adults will finally be eligible for health insurance coverage through the Medicaid program and will gain coverage as a result of the provisions in the Affordable Care Act. With health care reform, anyone who meets the income standard, especially adults without dependent children, will now be eligible to receive health insurance coverage through Medicaid. The low-income threshold for Medicaid for an individual is roughly about $14,000 for an individual, which is about 133% of the federal poverty level. The Affordable Care Act will make all individuals under 133% of the federal poverty level eligible for the Medicaid program, but getting them enrolled and signed up will be the responsibility of the states. But we know that the cost of our medical care is extremely high and rises rapidly, so that many states are currently struggling with the effects of the recession and the downturn in their revenues, which makes it more difficult for them to find the funds to support their share of coverage under the existing Medicaid program. The Affordable Care Act provides federal financing for the coverage of the new eligibles under Medicaid beginning in 2014 and continues for several years, but by 2019 begins to phase down to a 90% federal match, with the states coming up with the remaining 10%. So it's a very generous upstart from the federal government and really continues to be a substantial federal commitment to this that should not really put undue burden on most state budgets.